the Brazilian butt lifts, or the BBLs, which is a type of non-surgical treatment that uses liquid to enhance the size and the shape of your buttocks.
Yeah, so earlier this week, 2 people were arrested after the death of a British woman who recently underwent a non-surgical Brazilian butt lift. And whilst we don't know the details of her death at this stage, questions have been raised once again about the safety of this type of treatment.
In just a moment, we're going to be hearing from Bonnie Louise, who said she was left fearing for her life after getting a BBL.
First joined by 2 people, though, calling for these treatments to be banned. Ashton Collins, who is the director of Save Face, which is a national register for accredited practitioners, and cosmetic physician, Dr. Manav Bawa. Welcome to both of you. Thanks for joining us.
Thanks for joining us.
Doctor, let's begin with you. Can you explain what's the difference between a surgical BBL and a liquid BBL?
Absolutely. So the surgical BBL is when, under a hospital setting, a consultant surgeon will take fat from somewhere else on the body, for example, the abdomen or the thighs, and then re-inject that fat into the buttocks to volumize and shape. Whereas when we're looking at the liquid BBL, that's taking a dermal filler, so a hyaluronic acid filler, what we use for the face, the lips, for example, and inject large quantities into the buttocks to, again, create that volumization and contour.
We know a lot of people who do fillers in their faces. What is the difference, and why is it so unsafe to do fillers in the buttocks?
So there's lots of reasons why it's unsafe, and the first one is the anatomy of the buttock region. As we go a little bit deeper, there's lots of veins, blood vessels, and what can happen is the fat or the dermal filler can block those blood vessels, stopping the oxygen to the skin and the muscle. But also the fat or the filler can travel upstream and can go up to the heart, causing heart attacks, the brain strokes, pulmonary embolisms, and death, unfortunately.
And does that not happen if it's surgical?
So there is a risk with the surgical technique as well, and that's why BARPS, which is one of the plastic surgical societies, in 2018 called for it to be banned. They told their members not to do it anymore because there were a lot of deaths occurring.
Across the board?
Across the board. And that's changed in 2022. They're using a new technique, which is ultrasound guided. So highly specialised consultant surgeons are only recommended to do it now. Is it like the Wild West out there at the moment? Because it seems like there's no regulations at all. There's no regulations. It's something that we've been calling for a long time. It really is the Wild West. Anyone right now can pick up a syringe and inject patients, it's ludicrous. And we're seeing so many more problems and complications coming through.
So, Ashton, you've been calling for a ban on BBL since last year.
Yep.
What is it about them that worries you?
It's the volume of complications, like Manav said, how dangerous these procedures are, and they're being advertised on social media as being risk-free, pain-free, cheaper alternatives to the dangerous surgical counterparts. And we've helped over 500 women. 50% of those women have ended up in hospital with sepsis. 39% of those women have needed corrective surgery, have been left unable to walk. Many of them have been told that they're close to death when they arrive at hospitals. And that's why we are warning the government that unless they take urgent action, then we'll have fatalities.
Ashton, why do you think so many women are doing this? Are we just not loving ourselves anymore? What is it?
I think there's this insurmountable pressure to conform to a certain beauty standard. And I think, bigger bums have been in fashion now for a long time, perpetuated by reality TV stars and on social media. And when you see these things advertised as being risk-free, it takes an hour, you'll be in and out, it's cheaper alternatives, you can see why it's an appealing prospect for people. But all of those claims could not be further from the truth, and they are incredibly dangerous.
And there's no aftercare as well. That's a big, I would say that's a big risk as well, isn't it?
The lack of aftercare, and because in all of the cases that we've dealt with, they've been injected by non-healthcare professionals. So even when these ladies are presenting with really high risk, visible signs of sepsis and infection, they're being told it's just bruising, or they're being blocked completely and left to fend for themselves.
Would you like to see a ban of all of them, or liquid-based?
The liquid BBLs, yeah, because like Manav said, with the surgical ones, they are regulated procedures in regulated environments.
There's a risk, but it's regulated.
Exactly,
Gotcha.
And that person will look after you if something went wrong.
So let's bring in Bonnie Louise, who had a terrifying experience after undergoing the Brazilian butt lift treatment. Bonnie Louise Cooper, thanks so much for joining us, Bonnie. So you had this last November, I think, but then things didn't go as planned. So tell us about your story and your experience.
Gosh, so I had my liquid BBL back in November, just gone, and to my horror, I got poorly very, very quickly.
OK, just before we even go into that, can you just tell us why you actually wanted to have it done? What do you think, what was you lacking and what did you think that you needed from this?
So for me, the gym doesn't appeal to everybody. You might not get the desired results. It was a confidence boost for myself, and to my knowledge, it was a safe option.
But you was happy with the results at first. Was you happy with everything?
Yeah.
And then tell us when it started to go really badly wrong for you.
Gosh, I mean, it was immediate, really. As soon as I got home that same day, the pain was just horrendous. And the next day, I was rushed into hospital and paralysed from the waist down.
Oh, my goodness.
So, and was that sepsis, basically?
I did, yes. They advised me when I got to the hospital that I had sepsis.
So, what was the complications of that? Could you sleep? Could you sit? Could you even walk? Tell us some of the things that you went through.
My gosh, I couldn't stand properly. I couldn't sit. I couldn't walk at all. It was horrendous. I was just paralysed. Couldn't move.
Oh my God, you poor thing. Where did you get this done, and how are you now?
So I had this done in the London area. I still have complications now. So if I lay on either side, my legs actually go numb, leading to my feet changing colour due to circulation issues and nerve damage.
Oh my goodness, that's awful.
And Bonnie Louise, were you given assurances when you went in? I mean, how was it sold to you?
So I was completely under the illusion that it was completely safe, pain-free, minimal downtime. However, to my horror, the pain was horrendous, even having the procedure done.
It's awful. What would you say to anyone who's thinking about having one of these?
I would strongly urge anybody to completely stay away from the liquid BBL. It's very unregulated, very dangerous.
OK.
Thanks, Bonnie
Thank
Louise.
you for joining.
Really
I know you
sharing.
still get tingling in your legs now, don't you? You still get issues now, don't you?
Yeah, the pain is definitely ongoing.
Oh, poor thing. Well, listen, thanks for joining us. Really appreciate you opening up and telling your side of the story as well. Thank you, Bonnie Louise. Is this... do people have any legal recourse off the back of this?
Do you know what? Often, no. And people have often spent thousands of pounds on corrective treatment, corrective physiotherapy. And because it's not even a legal requirement to have insurance in the UK, often these people have no financial recourse.
Obviously, this isn't going to stop. People are still going to get these BBLs. I mean, what advice have you got for anybody who has any issues after they've had their operation?
Yeah, for anyone that's had any problems or even that's worried, I would definitely get in touch with Ashton at Safe Face. I think it's really important.
And is it a one-way ticket? Can you extract this as well, or once it's in, is it in?
It's very difficult, and the way that the product may have been placed, it may just spread, it may be in very hard locations to take out. So it's very difficult to correct once it's in.
Thanks so much.
Thank you, both of
Pleasure.
you, for joining us.